A diagnosis of breast cancer can be life-altering, but when patients are supported by an entire team, it's much easier to get through. And here to talk a little bit about that today is Dr. Lucy De La Cruz, and she's a breast surgeon at the Comprehensive Breast Care Program at Jupiter Medical Center. Dr. De La Cruz, thanks for joining us today.
Thank you so much, Kathleen.
So why is it important, why is the team approach important to breast cancer care?
So the team approach is important to breast cancer care, essentially because, as we move forward to a more personalized approach to treatment of not just breast cancer, but most, all cancers, we get, brainstorm ideas between specialists in the different modalities such as radiation oncologists, radiology, medical oncologists, the surgeons, the geneticists, even the nurse navigators that participate in the every step of the way care of every patient. So I think that when we look at breast cancer as a whole, we don't make decisions alone, we make decisions as a team. And I think that at Jupiter Medical Center with our multidisciplinary clinic is what we are essentially kind of bringing to the community, that perspective that we make decisions in a team approach, and at the end of the day what we are looking for is the benefit of our patients, that they're getting the best care possible, and also potentially improving their outcome.
So what is a multidisciplinary clinic? For regular people who are not in the clinical setting, that's a mouthful. What is a multidisciplinary clinic?
So a multidisciplinary clinic is essentially, we have a meeting in the morning, we present the cases amongst the specialists. We have visiting physicians from the community who also take care of breast cancer patients, and they mostly do it for learning, just to get themselves updated with the newest research. And we discuss each patient, and we talk about the radiology aspect, the pathology aspect, the radiation oncology, medical oncology, and the surgical aspect, as well as if there's any trials that we can potentially enroll them in, as well as if there's any use for genetic testing or any additional things that we may need. After we meet and we create a plan of care, which is directed specifically to that patient, it's not, it's not something that we just go by. We use NCCN guidelines, but obviously it's not that we put everybody in one box and everybody kind of goes the same way. We make a specific plan for each individual patient, and from there we see them at our cancer center, and that patient will be seen by all the specialists in one day. When they leave from there, they actually have a plan of care, and they know what I usually call it their roadmap. You get the diagnosis of cancer, and a lot of patients feel the fear of breast cancer, and I understand that. I get to deal with that on a daily basis with our patients, and I just think that when patients are treated in this way, they feel that they're not alone. They have our support, and there's a big support system. And at the end of the day, there's studies that show that their experience during cancer treatment actually improves their quality of life in the long run. So I think it's important, and we're doing a great job at it at Jupiter Medical Center with our multidisciplinary clinic. We're looking to expand it, and right now we're taking all patients to be able to be a part of this.
So you said that in fact the patient meets with multiple specialists in this clinic setting. What types of specialists are there?
So the same people that we meet in the morning. So the type of specialists that they would meet are for example, the radiologists are not there because they've already made the cancer diagnosis. So most of the times the people that they'll see are the people that are going to treat them for their cancer. So radiation oncologist, medical oncologist, and the surgeon. And at times the geneticist, if we feel that they need genetic counseling.
So are clinics available everywhere? Is this unique to Jupiter Medical Center?
In our community, it is. I know that in most academic centers, they do perform that. I know Mass General has their multidisciplinary clinic where I was at the University of Pennsylvania. We have the multidisciplinary conference where we meet, we discuss cases, and we go forward with a treatment plan that's specific to our patients. And I believe that that's what we're trying to bring to the community, an academic, mindset to a community hospital.
Explain to me, why does this multidisciplinary team translate into better outcomes or better care for patients?
That's a very good question. You know, how does this multidisciplinary clinic translate into better outcomes for patients? I believe communication. So a lot of patients get a diagnosis of cancer and they don't know what to do. They see a specialist or they see somebody and they tell them one thing, and then they see another person and tells them something else. And you know, you have the anxiety of having a cancer diagnosis, and then now you've added the fact that miscommunication, misinformation, getting different ideas or different comments from different physicians, and nobody's talking to each other. And I think that when you are facing a cancer diagnosis, you want to enter in a team approach. And what makes it so special is because everybody communicates, we talk amongst each other, and when the patient is presented with a plan of care, we are unified. And so some people say where there's union, there's a force, and I think it's definitely, you know, there's the force against cancer in the unity of the physicians as well. So
it's interesting. I envision like a patient, and just, you know, in the center, it really sounds like patient-centered care with all of these specialists around them.
Definitely. Patient-centered care is the future. I think that as we move forward, especially in cancer, we understand that not all cancers are created equal. We now understand the importance of the tumor biology, the impact on, you know, outcomes as far as there are different tumor biologies that are, you know, that we know about in breast cancer. And so I think that that's why each patient should be treated individually, patient-centered. It should not be treated as, you know, you are someone who has stage 1 and this is what you're getting. No, you are so-and-so and this is what your treatment is. And, you know, at the end of the day, I think that that's what this multidisciplinary clinic is about. Is creating a cohesive approach to someone who has a diagnosis of breast cancer for them to have a better experience, and not have different inputs from different sources and that may not necessarily agree with one another.
When you're part of a team, an entire treatment team, what do you as a surgeon get out of collaborating with these other specialists?
What I get, it's priceless, to be honest. I get, you know, collaboration of great minds. You know, you learn something new every day from other people. Also, ideas for research. Most of the research that I've done has been based on having these meetings in the morning, and, you know, the multidisciplinary team meeting and me writing them down, doing literature review, and then saying, well, there's nothing out there looking at this. And it wouldn't have been available to me, the idea, if I wouldn't have met with a group of people who are, you know, great thinkers, who know, and they're knowledgeable in the field, and, you know, we add to each other. So definitely it's a priceless experience for everyone.
Where do you see this going next? I mean, cancer oncology has developed this team approach. Do you think it could be applied to the rest of medicine?
I think it's a little bit more difficult applying this type of approach to the rest of medicine because you have to essentially, not everybody needs follow-up, for example. So if I remove the gallbladder of a patient, I'll see them in clinic and they won't necessarily need to be followed. I do think it would be ideal. Now, how feasible that is in fact, you know, like in written versus reality, I don't think that it'll be as easy as it has been for oncology. I think that the oncology, you know, community in general, not just the surgeons, but the medical oncologists, the radiation oncologists, and everybody that treats cancer patients has realized how important it is to collaborate, because it impacts their patient's outcome. I don't know if there's anything out there that would say the same thing for patients that don't necessarily have cancer. Now, I would say, for example, if you have someone who has high blood pressure, or someone who's obese or who's diabetic, maybe that would be someone who would benefit from a multidisciplinary approach, because you would have a nutritionist, maybe a therapist that would teach them how to do exercise, and then you would have the primary care physician who would lead the team, and the endocrinologist as well. And they would be able to kind of together meet and be able to create a plan to have weight loss, exercise, and potentially wean them off their insulin. Now, I don't think that's currently being done, but that's not my specialty, so I can't really comment on that. But definitely, I think now, just off the top of my head, I would think that something like diabetes that, you know, we have so much of in this country and in the world would probably benefit from this kind of approach.
As a breast surgeon, when you look to the future, what are you excited about on the horizon in terms of the fight against breast cancer?
Oh, there's what I'm excited about. There's a lot of excitement. There's so much research going on, especially like I mentioned, the tumor biology. There's a lot of genetic testing that's going on. We're going to get, I believe in the next 20 years, we're going to get to understand and be able to, essentially say what your risk is and what your best treatment is. I mean, we've done it so far. The Oncotype DX, which is a genetic testing of the tumor, can kind of calculate what your likelihood of recurrence is after surgery with or without chemotherapy, and using endocrine therapy, with endocrine therapy and chemotherapy versus endocrine therapy alone. And I think as we move forward, that's only going to get better and better, and we're going to be able to provide more personalized care than we do today. Another thing is I did research on dendritic cell vaccines, and I think that there's a big movement for prevention. So if we can prevent cancer rather than treating cancer, I don't know if we're going to ever get there, at least in my lifetime. I hope I do. I hope I become an artist and I don't have to do surgery for breast cancer. But I think that'll be a little bit harder. I do know that we were developing dendritic cell vaccines, which are vaccines to prevent patients from having recurrence of early stage breast cancer, like DCIS, ductal carcinoma in situ. And we had good results with that, and that's eventually going to go into bigger, nationwide trials. I'm very excited about that. If I can provide my patients with the opportunity of having something that will give them, better outcomes and potentially not having to suffer through cancer, in their lifetime again. Now, if in the very, very far future, if we could prevent it, then that would be even more exciting. Although, I don't know if I'll be around to be able to enjoy that.
Well, let's hope that someday we all get to see that development happen. That would be very exciting and save a lot of lives, no doubt. Dr. Lucy De La Cruz, breast surgeon at Jupiter Medical Center, thank you so much for joining us.
Thank you so much for having me, Kathleen.